Hi everyone, I want to talk to you today about pain. And the reason I want to talk to you about pain is because pain is prevalent in a lot of us. And I want to give you a couple of my thoughts around pain, and then I want to give you some thoughts around my principles for how pain might progress or regress in someone. So first, I want to start by discussing what pain is. Okay, pain is not weakness leaving the body. Pain is not, it's not an idea of no pain, no gain. Okay, pain is pain. Pain is your body telling you that something is wrong. And in that, there's stress or pressure or dysfunction at a joint, at a tissue. Something is wrong with your body, and your body's response to that is sending pain signals. Okay, pain can be crippling to someone, even if the actual issue isn't truly crippling. Pain can be detrimental to our mindset. It can be detrimental to our performance. It can be detrimental to technique. And so we are big believers in if something is painful, we've got to know about it. Now, another thing I discuss with clients, especially as they start with us, is how do we manage pain? Well, first of all, one of my main rules with pain is that we should be always moving through a pain-free range of motion. Now, that comes from maybe my rehabilitation background, but it is important that clients know that not all movement is bad for a client's joint, but pain-free range of motion is ideal. Because if I can keep a client in a pain-free range, that's going to be helpful to allow them to continue to move, but maybe not exacerbate any condition. So we always are promoting a pain-free range of motion in anything that we do. That also being said, is that pain needs to be understood that it's different than sore muscles. I expect a client's muscles to be sore. I sometimes even expect a client's joints to be stiff. Now, although that's not comfortable to work through or to work with, those are things that might be symptoms of exercising. Okay, muscles are going to get sore. We can stretch those muscles out. We can warm up a body tissue to help them promote some additional blood flow and work through some soreness. Okay, pain is different. Okay, pain does not necessarily always improve through stretching, and pain sometimes can be a structural issue. And it's not necessarily caused by an acute workout, but more chronic issues sometimes. So, pain is not necessarily muscle soreness, is not necessarily joint stiffness. The other thing I want to tell you about is how do we know pain is either progressing or regressing? So I adopted this principle years ago, and it was a principle that was actually attached to how you would adjust or how you would change up cardiorespiratory exercise. Back when I was studying for my first personal training certification years ago, and it was the idea of what's called the FIT principle, and the FIT principle was FITT, and what it stood for was frequency, intensity, time, and type. So although this was for cardiorespiratory exercise, I'm actually going to adapt it to pain. And so where I explain to clients, sometimes we have a client that might be coming back from an injury or might be working through an injury. And whether that injury happened in or out of the gym is besides the point. But I talk to them about this FIT principle as they're trying to stay active. And what this means is I tell them to ask themselves these questions around their pain. And one is frequency. How frequent is the pain occurring now? Originally, it was occurring every day. It was always painful. Now, it only occurs every few days, and it's only painful in that, couple of days, okay? That's helpful to understand the frequency at which something is painful. It could also be that the frequency was, it only hurt this time, and now it's hurting all the time. That shows us that a pain is progressing or an issue is progressing in the body. Intensity. Intensity is the second thing that I look at with pain. how intense is the pain? So sometimes you might go to the doctor and the doctor would say, on a scale of 1 to 10, how intense is your pain? Or how much does this pain bother you? And sometimes they even have charts of these little smiley faces or sad faces or whatever else. But how intense is the pain? Was the pain, it used to be at a 7 out of 10 and now it's a 3 out of 10? Okay, or it used to kind of only bother me a little bit. It was a little bit of pain. It was a 3 and now it's a 7. That shows us progression or regression of pain based on intensity of pain. The next section that I would look at is time, okay? And time means actually duration here. So how long does the pain stick around? Is it only painful in your shoulder after you do a shoulder press workout and it goes away the next day? Or is it immediately painful after the workout and it continues on for 3 days? Or it used to hurt me all the time during this 7-day stretch and now it's only hurting me for 1 to 2 days post-workout, okay? So that's the duration of the pain. Is it getting longer that it's sticking around, or is it only sticking around for a short amount of time? And the last part is type. So the type of pain also matters. I think all of us probably have had that instance of a painful event that was this sharp pain in our body, like, ooh, that hurt, and it almost stabs you like a knife, versus the pain that kind of lingers and it's more of an achy pain, or it's a dull pain, or maybe it's just a little bit of soreness. So the type of pain also matters. So again, to kind of review, one thing that we want to talk about is pain number 1 is your body telling you that something is wrong. So it is not something to ignore. It is not something that makes you weak. It is not something that makes you a sissy or a burden. So pain is pain. Pain is your body telling you something's wrong and we need to address it, okay? Number 2, we always want clients to work through a pain-free range of motion. We always want them to work through a pain-free range of motion in anything that they do. And then number 3, understanding the FIT principle when it comes to regression and progression of pain. Frequency of pain, intensity of pain, time or duration the pain sticks around, and the type of pain you're having. I hope this helps as you guys understand what pain really is. And the other thing here is that if you're experiencing pain with exercise or pain with common activities, and this goes for anybody, member, non-member, whatever, you need to seek professional guidance. In our client setting, we expect them to usually reach out to us first, as I have some background in this, and we can address what our activity plan would be moving forward as we work around some pain. But also know that there is only a certain scope of practice that a fitness professional might have. And so you may need to seek out other professional guidance from your family doctor, a physical therapist, or even an orthopedic doctor. So those are kind of the things that we look at. Obviously, your chiropractors are also batched in there as well with our medical professionals. So anyways, guys, if you want to know more about this or you have any other questions, drop a like to this video, post in the comments, and we'd be happy to connect more with you over certain consults that we have on our website, CrossFitMetroEast.com. Have a great day.